Hello, my name is Christina Jakob. I am a registered dental hygienist, and I've seen and read a lot of misinformation about the novel coronavirus pandemic. And even though I do not have a public health background, I have a bachelor's degree in a health profession and training and research. So here are some facts about COVID-19. The situation is changing hour by hour, but I've sifted through information and everything I'm presenting today is factual. First of all, what is a pandemic? A pandemic is an outbreak of a disease that occurs over a wide geographic area and affects a high proportion of a population. In this case, COVID-19 is a new virus that emerged in Wuhan, China, and is spreading around the world, and most people do not have immunity to it. How is it spreading? What we know right now, the virus is spreading from person to person between people who are in close contact, about 6 feet, through respiratory droplets produced when an infected person talks, coughs, or sneezes. The droplets can land in someone else's mouth or nose, or possibly be inhaled into the lungs. It can also be contracted by touching a surface or object that has the virus on it, then touching your own mouth, nose, or eyes. It is highly contagious. It spreads easily and sustainably, which means it spreads continually without stopping. We know that the virus can live for up to 4 hours on copper, up to 24 hours on cardboard, and up to 2 to 3 days on plastic and stainless steel. The symptoms of the new coronavirus are fever, cough, and shortness of breath. It seems to start with a fever followed by a dry cough, and after a week it can lead to shortness of breath, with about 20% of patients requiring hospital treatment. COVID infection rarely seems to cause a runny nose, sneezing, or sore throat. These have been observed only in about 5% of patients and are more often signs of a cold. 80% of the infections are mild with flu-like symptoms and the patients can recover at home. 13.8% are severe cases developing pneumonia and shortness of breath. 4.7% are critical and can include respiratory failure, septic shock, and multi-organ failure. Mortality rate reported by World Health Organization as of March 3rd is 3.4%. In China, mortality rate is 3.8%. Currently in Italy, the mortality rate is 8%. The most likely cause for this is the overwhelm of their healthcare system and doctors having to decide who to save because there are not enough resources. For example, in Bergamo, a city in Lombardy region, has run out of intensive care beds. Certain populations are at higher risk. Mortality rate for patients over 80 is 14.8%, and patients with certain health conditions also have a higher mortality rate. These health conditions are cardiovascular disease, so basically heart problems. Good to note here that 48% of American adults have some type of heart disease. Diabetes, chronic respiratory disease such as asthma, and high blood pressure. Pregnancy was just added to the list of high-risk conditions. The incubation period for the virus is 2 to 14 days. That means the time between when you get exposed to the virus to the time you show symptoms. The virus is contagious before showing symptoms. It is unclear for how long, but we know it's contagious at least 1 day before the symptoms appear. There have been no deaths reported in children 0 to 9, but children can be carriers with mild to no symptoms, aiding in community spread. Men have a higher mortality rate than women. This may be because men in China are much more likely to smoke than women are, and this virus affects the lungs. There are currently over 190,000 diagnosed cases. The good news is 81,000 have recovered, but there have been 7,896 deaths. The total number of cases and the total number of deaths has more than doubled since early March. In regards to testing, South Korea performs about 10,000 tests daily, while in the US, as of a couple of days ago, we had only performed 10,000 tests total. The Center for Disease Control is not currently publishing the total number of tests performed in the US. So what can we do? First, as the CDC says, wash your hands with soap and water for at least 20 seconds, pretty much as often as you can, but especially after you have been in public places or after blowing your nose, coughing, or sneezing. Keep your hands off your face. Stay at home if you experience any coughing, fever, or shortness of breath. Pretty much stay away from people if you are in a higher risk group or if you have friends, parents, or grandparents you interact with who are in a higher risk group. Remember, you can transmit the virus before you start showing symptoms. Per recent recommendations, do not gather in groups larger than 10 people. So far, everything I've done was present facts. Now, this is the part where I bring my own and public health officials' opinion. We've all heard flatten the curve. Right now, we're about 10 days behind Italy. 10 days ago, we had 300 cases in the US, and now we have 5,700. And remember, we've only tested a few more than 10,000 people. Unless we take social distancing seriously, there's a real danger of our own healthcare system being overwhelmed. There's already a shortage of masks and disposable gowns for hospital workers. In the dental field, the masks we normally use that filters out hepatitis, HIV, herpes, and all the other common viruses and bacteria do not filter out the new coronavirus. Because of this and the close proximity and the amount of aerosols we create in the dental office, the American Dental Association recommended yesterday that all non-emergency dental procedures be postponed for 3 weeks. We have a limited amount of ventilators and ICU beds and a limited amount of healthcare providers. Already, a number of healthcare providers have tested positive for the coronavirus. Is this virus, along with the need for social distancing, affecting our economy? Absolutely. But are people's lives more important than money? You bet they are. So let's social distance and let's be kind to each other during this crisis. Help out your older neighbors to pick up their groceries. Call your family and friends. Don't buy all the toilet paper. And let's stick together and we will get through this. But we have to take this seriously, America, before it's too late.